Since we have heard the relationship between food and disease, could you then tell us what is disease?
Sure. That should have been the question to ask when we first went to see the physician or the healer. What is disease? We want to know what is disease, because if we do not know the causes of disease, then it would be impossible for us to zero in on a meaningful cure or any cure at all. What is disease? The doctors never told us, but we kept going back to him. Now the question is asked to the Usha Institute. The question should have been answered by the anthropologists and the archaeologists. Why wait for the healer to come? Because if we are diseased and we are unaware as to the cause of our disease, then whatever comes after that means absolutely nothing, because our bodies are sick. Disease is when you have ingested a substance that was uncomplimentary with your genetical structure. As for the black man, his is mucus. Disease is the cause of, mucus is the cause of all disease. This was the question posed to me in court, that why were we making these claims and why were we so successful, and what was, what was going on? Is that disease was never identified to us. If it was identified, then the question would not be asked now, and then we all of us that are sick would be enjoying health. Well, disease is the accumulation of mucus, breaking down the mucous membrane, and that mucus covering groups of cells in your body. Like, for instance, we have the mucous membrane in the body to protect us from the onslaught of aerobic bacteria, as they are called. But this mucous membrane is for protection. But now we eat acid foods, and the acid food breaks down the mucous membrane and does cause it to flow with the blood, covering other groups of cells now, groups of cells that belongs to organs, depriving them of oxygen. If the mucus goes to your nostrils, they call it sinusitis. If the mucus goes to your bronchial tubes, it's bronchitis. If the mucus goes to the lungs, it's pneumonia. So we have 3 different diseases caused by what? Mucus. So what about when the mucus goes to the prostate glands? It's prostatitis. What about when the mucus goes to the uterus of the woman? That's endometriosis, or vaginal discharge, or yeast infection. So we have this mucus situation now that is caused by an inadequate diet. Mucus is the underlying cause for all disease. And this is where we specialize at the Usha Research Institute in making those compounds to aid the body to remove the mucus from itself.
Well, let me ask you this question. When someone comes to the Usha Herbal Research Institute and they've been diagnosed by their doctors having the AIDS virus in their body, are your dietary recommendations and herbs that you prescribe for them, are they any different from what you would subscribe for someone who has a different disease, like sickle cell anemia? Is there any difference?
There is no difference. There's absolutely no difference. And this was shown to me in St. Croix, where the Usha Research Institute opened its doors for the first time under the name of the Fig Tree at 429 King Street in Frederickstad, St. Croix. 3 people came to see me. One had diabetes and blind and delirium tremens, which was Miss Margaret Allen. And then we had another gentleman by the name of Flores Archias with gout. And then we had another lady with arthritis, Miss Sylvester. And they noticed that they had the same compounds in front of them. Flores Archias said to me, "I think you're making an obvious mistake." I said, "Why?" He said, "Because I didn't come with the diseases that all these other people have. One is blind and diabetic and delirium tremens. I do not have that, but I have the same bottles they have." Sure. I have to cleanse the body. Whether you have AIDS, blindness, diabetes, or whatever disease, the cells are now obstructed with mucus. Like in the case of AIDS, the only thing I have to do is to give you an increased dosage of lympholine that is going to revitalize the lymphatic system. Sure, it is the same treatment. There's the cleansing and intracellular cleansing coupled by the African biomineral balance. This is for every pathology or irritation presented. Yes, we give the same treatment.
Mm-hmm.
This article in the Amsterdam News states that Emma Wright, a former sickle cell patient, after being on your dietary regimen, has been cured of sickle cell. If so, how come the medical world does not know about all these miraculous cures?
Well, it could be attributed that the very premise that they uses, the usage of carcinogens and inorganic substance, could be undermining their profession. But if we look at the history of medicine, we find that the credit was given to one Hippocrates as being the father of medicine. Didn't he build the foundation of medical science by using herbs to reverse pathology? Sure, he used herbs, and he was successful in removing all pathologies. But he used herbs. So if the father of medicine used herbs to remove pathology, then why should the physician use chemicals today? That question should be asked of them. What is the reason? Now, as for the miracles, the herbs assimilate because they contain carbon, hydrogen, and oxygen. This is the vehicle that would allow any substance to assimilate within your biological structure. The presence of carbon, that only comes from the plants. It does not come from some oxide or inorganic substance. But as for Miss Emma Wright and her sickle cell, the mucus was invading her blood plasma, breaking it from a circle into a sickle, allowing oxygen and iron to escape. That is one of the things that we also found in our journey into this thing we call the African biomineral balance, is that like the burdock eats iron and the kalawala phosphate, potassium phosphate, the black man needs large amount of nascent iron. That is his mineral. Like iron is consistent with the burdock, like bamboo shoots and berries are consistent with the gorilla, all plants that contain iron is consistent with the genetic structure of the black race. In the case of Miss Emma Wright, iron was missing in her diet, not only in hers. Every so-called black American or every so-called black man throughout the world is lacking of iron. So what did we do? We cleanse the cells of the blood, cleanse the cells of the bone, cleanse the cells of the spleen, thus allowing rejuvenation in the organs that are responsible for delivering good, healthy red blood, and giving the blood its strength by going again to the tropics and getting the herbs such as the mucilage to make compounds with other herbs, which are 14, to rejuvenate the cells of the blood. And 2 months later, she came back and said that her sickle cell had disappeared. But this is a problem that is besetting Africa also, not only Miss Emma Wright, every black living person. But not only did she have sickle cell, she told me that she was suffering with thalassemia, which I was unaware of, but I didn't care because she was going to undergo the same process as everyone else. She said her thalassemia had disappeared. But then she found out later when she was in Los Angeles that she ate something that I recommended to her not to eat, and her body went back into the same state that it was prior. But she changed her diet again, and again she saw where her body was back in normal state. So it shows that the diet of the African American, especially the black man, has to be considered now. Has to be considered because it is one that has never been presented to us. And it's very crucial, not only with the sickle cell, with any other pathology.